subject that has brought a lot of interest. When I post treatment like surgery, I was really upset because this is a knowledge that many people have like them and is not available to the general public. Mm, if anybody in Facebook wants to register and to participate in the phone call, you are more than welcome. So thank you, Stephanie, for letting me know about the sound. Um, this is the first question. Why there are so many unnecessary biopsies? And what can we do to avoid unnecessary biopsy or treatment? So two questions. Why there are many unnecessary biopsies?
I think the answer to that question lies in the fact that most women are undergoing mammographic testing, and the mammograms are showing very small, innocuous, millimeter-sized lesions, and the medical community has decided that everything is potentially cancer, so they are biopsying everything. Part of that, I think, is a medical legal issue, and part of that is because this is the way we have evolved in terms of our approach to cancer. The American Cancer Society in 2017 came out and said that there are way too many unnecessary biopsies, and beyond that, there is treatment being rendered to cancers that would never cause an alteration in lifestyle, much less death. And yet every time a suspicious lesion shows up, someone feels compelled to biopsy that. And I think the answer to the second question lies in thermography, which shows the physiologic activity of the breast. So if the breast physiology is deemed to be normal, even in the face of some of these tiny lesions, maybe watching and making alterations in lifestyle and dietary adjustments may be enough to cause a reversal in that and not cause unnecessary biopsies, of which there are over 850,000 in this country alone every year.
And how is it that the medical establishment established that anything that looks abnormal in a mammogram, which is an X-ray, I understand that mammograms or X-rays were developed to detect bones. How on earth they decided that, well, we are going to use X-rays to detect cancer? So why the medical establishment using just mammograms, they decide that anything that is abnormal in a breast of a woman could be a cancer?
The first part of the question we lost a little bit, Carlos. So you're saying why with the mammograms, anything that they find suggests cancer?
Yes.
I think, again, we live in a litigious society, and we live in a society where physicians practice in fear of missing something or in fear of lawsuits. And so it is safer and easier for the physician to biopsy a lesion that's suspicious and to miss it and run the risk that it's a cancer and somebody's going to come back and say you missed the cancer and sue them. And it's an unfortunate way to practice, and it's an unfortunate reality, but I think it is nonetheless a reality.
Well, we need in the let's say, self-development work that we do as a human beings in the spiritual world, that making a decision out of fear is more likely that it's not going to be right. There is a woman, Anita Morjani, she's featured in the movie, in the documentary Heal. She had cancer, she died, and on the other side, she realized that she was making all the decisions of her life based out of fear, and she had cancer all over her body. She came back by being clinically dead, and in 5 weeks or 7 weeks, all the tumors were gone because she replaced fear by love. So this is my opinion. I believe in the medical system, in the medical schools, they teach, they train these young people to make decisions out of fear. But maybe this is not the subject that we are going to talk about. But I need to point out this because this is very important.
Carlos, I just would like to say something about it because I think your point is very well taken and is very important. Cancer is scary, but there is so much fear around the whole breast cancer industry that women are being corralled and pushed into doing things because they are literally scared to death, you know, because there's just so much hype and you know, like, for instance, if a woman wants to have an ultrasound of the breast, they have to have a mammogram first. Well, why? If you want to have an ultrasound of your belly, for instance, you have an X-ray first. So it's these protocols and these things that are in place that are really corralling women and forcing them into making choices, and they're
went through the chemo and the radiation, which is way worse than having a cancer that's going to be, it's not going to change their life. So I think that you're correct. People up, we have this great fear factor. We base cancer